Welcome back everyone. Today I'm going to show you some massage techniques to alleviate sciatic symptoms that could be possibly caused by fake sciatica or piriformis syndrome. The piriformis muscle is attached from the sacrum, also known as the tailbone, and then inserts into the femur, also known as the long thigh bone. This muscle's main action is to externally rotate the legs outwards, and if this muscle gets tight, it can impinge on the sciatic nerve that runs from the back into the hip at the back of the piriformis muscle, or either through the piriformis muscle and then down into the leg. So if this muscle gets tight and spasming, it can squeeze on the sciatic nerve and cause referral pain from the hip down to the back of the thigh, back of the knee, and possibly down to the heel as well. So these massage techniques will help release the tension in the piriformis muscle and alleviate a lot of the pain that could be caused by the piriformis muscle or referred pain from the sciatic nerve down into your leg. Try out these massage techniques. I hope they help you as much as they help me and my patients.
Foam roller massage. Place your hip on the foam roller so that the foam roller is pressed on the back of the hip and slightly to the side of the hip. This is where the main muscle bulk of the piriformis muscle is. You can prop yourself up on the arm on the same side and use your opposite leg on the other side to help you push your body up and down the foam roller. Try to roll from the top of the hip down to the buttock and teasing out all those tight muscles in the rear of the hip. Don't be afraid to spend extra time on any tender or tight spots that you find along the way, as there could be a good chance that these spots are causing you issues as well. Just work on each tight sore spot for 1 to 2 minutes and repeat the process on both sides 5 to 6 times. I must warn you, as you might need a bit of strength to hold yourself up with the arm behind you. However, this technique is the least aggressive compared to the other following massage techniques in this video. I recommend using a soft foam roller first, and once you're ready, you can move on and use a hard foam roller with treads on it. They tend to be a bit more aggressive on the muscle fibers. I'll leave a link in the description box below on where to get them. Stretched piriformis massage. Place the side of the hip that you like to massage on the foam roller and place the ankle on the same side that you're trying to massage on the supporting knee on the opposite side. This will place the hip in rotation and elongating the piriformis muscle and exposing more of the muscle fibers to massage. To ensure your ankle doesn't slip out of place, you can just hold on to your shin bone. Have the arm on the same side prop you up and the opposite foot to help you push and pull the body so the pressure from the foam roller massages the muscle. Just simply roll up and down the muscle fibers of the piriformis muscle and slightly lean to the side you're trying to massage. This way you'll be shifting your body weight over to the foam roller, and this will create more pressure and intensify the massage. If you find a tender spot or tight area, don't be afraid to spend more time here and work on that area. Do this for about 1 to 2 minutes and repeat it on both sides 5 to 6 times. Piriformis muscle stripping. Place a massage ball in the back of the hip and shift your body weight on top of the ball whilst leaving your hips open, and shift your body back and forth over the ball to massage the fibers out of the piriformis muscle. This is also called longitudinal muscle stripping, a massage technique that's used by many manual therapists such as myotherapists, osteopaths, physiotherapists, and chiropractors. If you find a tender spot, don't be afraid to work on that area a little bit longer till the pain dissipates, and don't be afraid to explore other areas and other spots in the hip so you can work on it as well. Chances are these areas could be causing issues as well, and it doesn't take much to just work them out so you can gain the benefits. Do about 1 to 2 minutes on each hip and repeat the process on each side 5 to 6 times. A research paper was published in 2016 in the Journals of Pain Medicine on how massage therapy impacted the function in people experiencing pain. Based on the outcome, it showed that massage therapy was very effective compared to placebo treatments, and even proved that it helped with anxiety as well. However, in my opinion, even though massage is a great way to reduce pain and mental stresses that come with pain, it is important to acknowledge that without strengthening our weaknesses or the causes of injury, we will keep getting injured and keep suffering from the same issues, or even worse, start getting pain and injuries from somewhere else in the body due to compensation. So please check out the other exercise videos on this channel to make sure you don't re-injure yourself or suffer the pain once again. Myofascial muscle release. Place the massage ball on the back of the hip on the piriformis muscle, which is in between the tailbone and the bony prominence of the femur on the side of the hip. Slightly shift your weight onto the ball, leaning towards that side. Once you feel a tender spot on the muscle, open and close your hip by bringing your knee towards the floor and back up again. This will activate the muscle by opening the hip and deactivate it when you're closing the hip. Once you feel the pain and the tenderness dissipate, try to find the next tender spot and work on that area. If you're unsure, just work on the muscle for about 30 seconds and move on to the next area. Don't be afraid of going back to the same spot and working on that area again to release the tension and the tightness of the muscle. A good rule of thumb to follow is to do each side 1 to 2 minutes and then alternate on each side 5 to 6 times. Muscle stripping the piriformis muscle. If you don't know where to get a massage ball or a foam roller, I'll leave a link in the description box below. Place the ball on the back of the hip on the side that you like to work on and slightly lean onto the side, shifting your body weight over that ball. This will add more pressure onto the muscle fibers. Similar to the piriformis stretch, place the ankle on the side that you're trying to work on the opposite knee and with both of your arms placed behind you to support your upper body. To take advantage of the smaller point of pressure from the massage ball, roll the ball from the start and end of the fibers of the piriformis muscle. So that means use the massage ball to roll from the origin of the piriformis muscle, which is the side of the sacrum, aka the tailbone, then roll it all the way to the insertion of the muscle on the femur bone towards the side of the bony prominence of the hip. This technique is also known as longitudinal muscle stripping. Work on this muscle for about 1 minute to 2 minutes and repeat the process on both hips 5 to 6 times. This is one of the most aggressive ways to massage this muscle because most of your body weight is actually on a small surface area, the massage ball. So please try the other piriformis massage techniques first before doing this one.
Once again guys, thanks for watching. I really want you to join my VIP Facebook group. I want to build a community there where you can ask questions and I'll do my best to answer them as soon as possible. There'll be other health professionals in there as well to help you out. Now if you found this video helpful, I highly recommend you check out my piriformis stretch video. That video will definitely help you out if you do have a tight piriformis muscle that could be referring pain down your leg. Now if you do have a weak piriformis muscle that could be spasming because it's not strong enough, I highly recommend you check out my piriformis exercise video. That video will definitely help you out if you do have piriformis syndrome caused by a weak piriformis muscle. Remember, support my channel, hit subscribe, hit like, comment below if you have any questions, and I'll see you guys in the next one.